Welcome to the deep dive. We're about to take a deep dive into a case report from Clinical Case Reports.
Oh yeah, get ready for a real brain teaser. This one is very technical.
So if you're a veterinary specialist and you love neurology, you are in for a treat.
Definitely geared toward those who really want to geek out on the neurology side of things.
All right, so let's set the scene. We've got a 16-year-old cat.
16 years old. Wow, that's up there for a kitty.
It is. And this cat suddenly starts showing all these neurological signs, ataxia, disorientation, you name it.
The kind of symptoms that make any vet's heart sink a little.
Exactly. And to make matters even more interesting, this cat is having seizures.
Seizures always complicate things.
They do. But these aren't just any seizures. We're talking about seizures with very specific orofacial movements.
Orofacial automatisms. Now, those are intriguing.
They really are, like little clues about what's happening inside the brain.
Exactly. Those orofacial automatisms often point to the temporal lobes, but
as we'll see in this case, things aren't always so straightforward.
oh, this is one of those cases where things get a little more complicated.
So the veterinary team decides to do a brain MRI on this cat. And let me tell you, the MRI findings are fascinating.
Oh yeah, the MRI report is a goldmine of information.
What was your first thought when you saw the description of the mass?
Well, the first thing that caught my eye was the location. The right piriform lobe.
Not exactly a common spot for a mass, is it?
Not every day you see that. And the way they describe it in the report as this ill-defined, round, intraaxial mass. Like, okay, we've got a puzzle on our hands.
So break it down for us. Ill-defined, round, intraaxial. What are we really talking about here?
Right. So ill-defined just means it doesn't have those nice, clear boundaries.
It's like it's blending in with the surrounding brain tissue.
Exactly. Which can sometimes make things tricky if you're thinking about surgery, right? Well, that one's pretty self-explanatory.
Gives us an idea of the shape, at least.
Yeah, although they don't actually give us any dimensions in the report.
And then there's intraaxial, so it's within the brain itself.
Exactly. As opposed to like a meningioma, which would be growing from the meninges.
Gotcha. So it's not just pushing on the brain from the outside. It's
Yeah.
right there in the thick of things.
Yep, right in the parenchyma.
Okay, so we've got the location and the general description. Now let's talk MRI sequences. You know, those T1W, T2W, FLR. What do those tell us about what's going on inside this cat's brain?
Ah, yes, the alphabet soup of MRI. It's all about highlighting different tissue characteristics, right?
Right, so like T1 weighted images.
Yeah.
What are we looking at there?
T1W, those are great for seeing the anatomy, you know, those nice anatomical details.
And what about T2 weighted images?
T2W, those are really good for picking up changes in water content. So if we're looking for edema or inflammation, those are our go-to.
And in this case, what did the T1W images show?
Well, on T1W, the mass appeared hypointense,
Hypointense meaning?
meaning it looked darker than the surrounding brain tissue.
Okay, so it's different from normal brain tissue, but not necessarily telling us exactly what it is.
Yeah, right. It's just a clue. But then when we switch over to the T2W images, things start to get really interesting.
Oh, I do love a good plot twist. What happens on T2W?
On T2W, and also on T2FL or air and diffusion weighted images, the mass really lights up.
Lights up meaning it becomes...
Hyperintense. It appears brighter than the surrounding tissue.
Which makes us think.
It's got more water content than normal brain tissue. So we're thinking inflammation edema, maybe even certain types of tumor growth.
And just to add to the intrigue, the report mentions extensive perilesional edema surrounding the mass.
Oh yeah, it's not just the mass itself. The whole area around it is affected.
Not a good sign.
Really. It tells us this mass is really disrupting things.
Disrupting the peace in the brain.
Exactly. That edema, that swelling, it can be caused by a breakdown of the blood-brain barrier, you know, like the brain security system.
Right. When that security system fails, things can get messy.
Exactly. And then they use a contrast agent during the MRI gadolinium.
Gadolinium. That's the one that helps us see if the mass is vascularized right.
Exactly. Does it have a lot of blood vessels feeding it?
And in this case?
The center of the mass showed marked homogeneous enhancement after they injected the gadolinium.
So it was like
it was soaking it up. And that usually means there's increased blood flow and blood vessel formation.
which we often see with
tumors, unfortunately.
So to recap, we've got this mass in the right piriform lobe. It's looking pretty suspicious on MRI with that heterogeneous appearance and all that surrounding edema. It's enhancing with contrast.
It's not looking great for this kitty so far.
Not at all. But here's where things get even more interesting. Remember those orofacial seizures we talked about?
How could we forget those?
Well, the MRI also showed some significant findings in the hippocampus on both sides of the brain.
Bilateral hippocampal changes. Oh, boy. This is where things really start to get complicated.
The hippocampus, that's like the memory center of the brain, right?
Exactly. It's vital for forming new memories, spatial navigation, all sorts of important functions.
And in this case, what was going on with the hippocampus?
Well, the MRI showed bilateral hippocampal swelling. And just like the mass hippocampi were hyperintense on T2W, T2LRR, and DW images.
So similar to the mass in that way.
Yes. And here's the kicker. They also showed contrast enhancement.
Okay, now my brain's doing backflips. Could the mass and the hippocampal changes be related?
That is the million-dollar question. And to answer that, we need to dig a little deeper into the diagnostic workup. Yeah, it's like we've got these two separate but potentially connected mysteries happening in this cat's brain.
And we're trying to figure out if they're related or just a case of terrible coincidence.
Exactly. So the next step in this diagnostic odyssey was a cerebrospinal fluid tap, a CSF tap.
Yes, peeking into the brain's mailbox to see if we can find any clues.
Exactly. What kind of messages are floating around in there?
What did the CSF analysis reveal in this case? Anything interesting?
Well, the first thing that jumped out was an elevated protein concentration.
Elevated protein. Okay, that definitely gets our attention. How high are we talking?
The protein level was 75 milli-GDL. That's significantly higher than the reference interval.
Wow, 75. That's quite a jump. So what does that tell us about what might be going on in this cat's brain?
Well, it's not a specific finding in itself, but it definitely narrows down the possibilities.
Like what kind of possibilities?
Well, elevated CSF protein without an increase in cell count, which is what we saw in this case, is sometimes called albuminocytologic dissociation.
Albuminocytologic dissociation. It's a good thing this isn't a tongue twister contest.
Right. But seriously, it can be seen with a bunch of different conditions, including some brain tumors, inflammatory diseases, even some infections.
So again, we're left with a lot of maybes and not a lot of definites.
Exactly. It's like trying to solve a jigsaw puzzle with half the pieces missing and the picture on the box is blurry.
And unfortunately, in this particular case, the story takes a turn for the worse.
Yeah, this is the part where things get really tough.
Despite the veterinary team's best efforts, this cat's condition just didn't improve.
It's always hard when you're fighting so hard for a patient and it's just not enough. It's heartbreaking. And ultimately, the owners made the incredibly difficult decision to say goodbye.
As you said, a really tough decision, but an incredibly compassionate one.
Absolutely. And in their compassion, they also allowed for a histopathological exam of the brain.
Which is huge from a diagnostic standpoint.
Absolutely. It gives us that definitive diagnosis that we're always striving for.
The gold standard.
So what did the histopathology reveal? What was the final verdict in this case?
Get ready for it. The histopathology confirmed the presence of a gliosarcoma.
Gliosarcoma. Okay, that's a mouthful. And if I'm not mistaken, a very bad diagnosis for a cat.
You are not mistaken. Gliosarcoma is a rare and aggressive type of brain tumor.
So we finally have a name for this villain. But what exactly is a gliosarcoma, and what makes it so different from other types of brain tumors?
Well, for starters, it's actually considered a subtype of glioblastoma.
Glioblastoma, another one for the vocabulary list.
Right, and glioblastoma is a highly malignant tumor that arises from glial cells in the brain. Glial cells. Those are like the support cells of the brain, right? Not the neurons themselves, but the cells that kind of help the neurons do their thing.
Exactly. They're like the stage crew of the brain, making sure everything runs smoothly.
And there are different types of glial cells, right? Each with their own specific job.
Yeah, you've got astrocytes, which help maintain that all-important blood-brain barrier, and oligodendrocytes, which help insulate nerve fibers.
So many important jobs. But when these cells become cancerous, that's when we start seeing problems.
And in the case of gliosarcoma, it's not just one type of cell going rogue. It's like this weird mix of glial cells and these other cells called spindle cells.
Spindle cells. Where do those come from?
They're actually characteristic of cancers that arise from connective tissue. So it's like this Frankenstein's monster of brain tumors with parts from different cell lineages.
Okay, so gliosarcoma, bad news all around. But let's not forget about those mysterious hippocampal changes we saw in the MRI. The histopathology confirmed those too, right?
Oh yeah, those hippocampal changes were definitely still there. The histopathology showed clear evidence of hippocampal sclerosis.
Hippocampal sclerosis. And this is where I think even the most seasoned veterinary neurologists might start scratching their heads. We've got this gliosarcoma, which is bad enough on its own. But then we also have this hippocampal sclerosis. Could they be connected?
Yeah.
Or are these completely separate issues happening in the same unlucky cat?
It really makes you wonder what's going on, doesn't it? Are these two things related or just a case of really bad luck?
It's like finding two different puzzle pieces that don't seem to fit together, but we know they must be connected somehow.
Right. And this is where those orofacial seizures really come into play.
Because they make you think about feline limbic encephalitis, right? FEPSO?
Exactly. You see those orofacial seizures, and you can't help but think FEPTUS.
But FEPSO is an autoimmune disease, isn't it? It doesn't usually involve brain tumors, does it?
You're right. FEPTUS is typically considered an autoimmune disease. It's like the body's own immune system goes haywire and starts attacking the brain, specifically the hippocampus.
And we see FEPSO most often in younger cats.
Yeah, exactly. It's much more common in younger cats.
And here we have a 16-year-old cat with a confirmed brain tumor and hippocampal sclerosis.
It makes you wonder if FEPSO could even be on the table in this case.
Right. It's not impossible.
It's definitely atypical. And you bring up another important point. The gold standard for diagnosing FEPSO is the LGI-1 antibody test.
The LGI-1 antibody test.
Yeah.
So did they do that test in this case?
Drum roll, please. They weren't able to.
Oh, no.
Not enough CSF or serum available.
Oh.
It's always frustrating when you're missing those key pieces of information.
Talk about a diagnostic dead end. So we're left wondering, could this have been a misdiagnosed case of FEPSO all along?
It's definitely a possibility. We have those classic FEPSO-like signs, the orofacial seizures, the hippocampal involvement.
But without that LGI-1 antibody test, we just can't say for sure.
Unfortunately not. It's one of those cases where you just have to accept that you might never have all the answer.
Which I'm sure is incredibly frustrating for everyone involved.
Oh, absolutely. But even though we might not have a definitive answer about FEPSO, the authors of this case report did offer some alternative explanations for the hippocampal sclerosis.
Oh. Like what?
Well, one possibility they raised was post-ictal changes.
Post-ictal meaning?
Meaning changes that occur in the brain after a seizure.
So the seizures themselves could have caused the hippocampal changes?
It's possible. We know that prolonged or frequent seizures can cause changes in the hippocampus in humans.
And I'm guessing the same could be true for our feline friends.
Exactly. It's not as well documented in veterinary medicine, but there have been reports of suspected post-ictal changes in cats with seizures.
So it's like a chicken or the egg situation.
Yeah.
Did the seizures cause the hippocampal changes, or did the hippocampal changes contribute to the seizures?
It's really hard to say for sure, and that's what makes this case so fascinating, but also so frustrating.
But really highlights the complexity of the brain and how much we still don't fully understand.
Absolutely. Even with all the advances we've made in veterinary neurology, there are still so many mysteries hidden within the brain.
Mysteries that continue to challenge us and push us to learn more.
Exactly. And that's what makes this field so rewarding.
Well said. This deep dive has certainly given us a lot to think about. A rare tumor, hippocampal sclerosis, and the lingering question of possible FEPSO.
It really highlights the challenges and the rewards of veterinary neurology.
Absolutely. Any final takeaways for our listeners? What should fellow veterinary professionals, especially our neurology enthusiasts, take to heart from this case?
I think the biggest takeaway is the importance of a thorough and systematic approach to these complex neurological cases.
We can't just jump to conclusions. We have to consider all the possibilities.
Exactly. And even then, sometimes we have to be comfortable with not having all the answers.
It's about using all the tools at our disposal. The history, the clinical signs, the imaging, the histopathology, and our own clinical judgment to guide our patients toward the best possible outcome.
Couldn't have said it better myself.
This case, with all its twists and turns, reminds us just how amazing and intricate the brain truly is.
It's a constant source of fascination and frustration.
But that's what keeps us coming back for more, right?
Absolutely. Always learning, always growing, always striving to provide the best possible care for our patients.
Well said. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.